I want to remind you of Barbara Jordan as we sit in her facility. She had said to us, let us not call for black power, let us not call for green power, but let us call for brain power. And today we're going to be all about brain power, okay? Without further ado, I want to introduce to you the Secretary, Kathleen Sebelius.
I don't think there's any new news in the notion that we have a big gap in the way healthcare is distributed throughout this country and in terms of the health outcomes of various segments of the population. No question that African Americans and Hispanics and Native Americans are often the victims of some of the disparate care that we find throughout this country. We are taking this very seriously at the new Health and Human Services. But I want to start by saying that those of you in this room, as journalists, have a key role to play. I think you have an opportunity and a responsibility to shine a light on what's going on and to really spread the call for a change to be made. That often this issue is one that's kind of buried under the headlines. It's not the most exciting story to write about, but it's one that we think is really critical.
And as America's doctor, I hope to provide Americans with the best scientific information available on how to live healthier lives. And I want to attempt to bring some clarity and some understanding to the overwhelmingly confusing conversations that are going on about health and health care.
At the Joint Center, our position has been that you can't achieve these goals unless equity is a central objective of the legislation. Now, what do I mean by that? Some people may say, well, if you're expanding insurance coverage, and particularly given that half of the 46 million uninsured are people of color, then that's equity, isn't it? Aren't we getting toward equity? Well, that's important, but it's not sufficient to eliminate disparities in health and health care.
We need to improve the infrastructure of our community health centers and clinics and have that money infused into our communities so that we can have what we're talking about: access, affordability, availability, because it's down the street, and we can also train and have people who look like the community in these health centers, because we are committed at the Black Women's Health Imperative and other groups to making sure that we continue to fight for comprehensive reproductive health services, including everything that women need to be okay.
The domestic epidemic is primarily about Black people, and so when we have an epidemic out of control here in this country, it is primarily about us. And that's the news story that is absolutely imperative that you all keep reporting.
African Americans by far are less likely to know their HIV status compared to other populations. And if you don't know your HIV status, as I just mentioned, you're more likely to transmit HIV to someone else within your community. So that's another issue as to why we're seeing some of the disparities among African Americans. Another one is limited access to care. It's very clear, I'm sure you've already heard during this conference, that African Americans have limited access to care compared to other communities. And there are life-saving drugs that we have out there for people living with HIV to allow people to live longer, but also to reduce HIV transmissibility. If you don't have access to those drugs and you have a higher viral load, you're more likely to transmit HIV compared to somebody who's taking those drugs. And in the African American community, we don't have as much access to those drugs for various reasons.
Our communities have got to understand that our relationship to food, if not the most, I'd say it's the second most important determinant of our health. And as long as we allow others to determine what food we consume, we are allowing others to determine our destiny.